Good day everyone! My name is Jonalyn Caintoy from BSN 1A, St. Paul University, Dumaguete. So now I'll be demonstrating the nose, mouth, and sinuses. And before I start this demonstration, I need to give private privacy to my patient, like close the door, the curtain, and the information, and proper hand hygiene. So, I already gathered my materials. Pin light, gloves, gauze, thumb blade, water, stethoscope, and otoscope. But I don't have otoscope. So now, I will start this demonstration. Then I will introduce myself to my patient. What is the purpose of this demonstration? Hi sir, good day. I am Jonalyn Caintoy, your nurse student today. And then I will demonstrate the nose, the mouth, and the sinuses. The purpose of this, sir, is to check if there is problem in your mouth or pain, tenderness, thumbs, and drainage, and also to your mouth and to sinuses. So, sir, may I know your name?
Jerome.
How about your age, sir?
70.
Okay, sir, thank you. Sinuses. First, inspect frontal sinuses, inspect above the eyes, and transilluminate by shining light upward under eyebrow and chest. Check for red glow. Sir, it's okay if I will inspect your frontal sinuses?
Yes.
Normally an air-filled sinus. Red glow noted above eyebrow. And now, I will inspect maxillary sinuses to my patient and inspect below the eye and transilluminate by shining light below eye and check for red glow. So sir, I will inspect. It's normal and red glow noted on the roof of mouth. So now, I will palpate and percuss for tenderness. Palpate frontal sinuses, palpate maxillary sinuses, and percussion or percuss frontal sinuses and percuss maxillary sinuses. So sir, I will palpate and percuss your frontal sinuses and maxillary sinuses. It's okay for you, sir?
Yes.
Do you feel some pain, sir?
No.
How about here, sir?
No.
So now I will percuss your frontal sinuses and maxillary sinuses, sir. Okay, sir. As I palpate and percuss my patient frontal sinuses and maxillary sinuses, My patient said no tenderness to percussion and palpation, and no crepitus is evident. So now, I will inspect your nose, sir, for color, position, and discharge. It is okay for you, sir?
Yes.
So I will use pin light. So it is smooth, symmetric, and straight position, and the color is the same at the rest of the face. And I will inspect internal nasal mucosa, tilt the head of my patient, and use pin light to inspect the nasal mucosa. Sir, I will inspect your internal mucosa. Can you tilt your head? So the internal nasal mucosa is dark pink and clear, moist, and free of exudate. Internal mucosa of my patient is dark pink, clear, moist, and free of exudate, no lesion. Inspect turbinate. So turbinate is also a dark pink, moist, and free of lesion. So then, I will palpate for fantasy of each nares. So sir, I will occlude your left nostril and right nostril. So also in the left. So it is silently mobile, non-tender, no masses, patient able to sniff through left nostril and right nostril. Now, I will proceed for the mouth demonstration. Inspect lips for color, condition, lesion, and odor. Inspect anterior portion of lips and expose and inspect posterior portion of lips. So what I said earlier, it is pink color, smooth, moist without lesion, no tenderness and swelling. My patient teeth and bite. Instruct the client or patient to open and close the mouth. Check the number of teeth and check color and condition of teeth. Can you open your mouth, sir? Big, please. So, as I count my patient teeth, it is 30. It is pearl whitish teeth with smooth and surface and edge. The color of the teeth of my patient is whitish teeth, then the condition is okay. Your teeth, sir, is pain,
No.
and there's no tenderness, lumps, or swelling in his teeth. So now I will inspect oral mucosa and gums. Visualize oral mucosa with tongue blade. Use pin light in assessing oral mucosa, and while I inspect oral mucosa and inspect gums. Sir, I will inspect your oral mucosa and gums. Can you open your mouth, sir? So gums is consistent in color with the oral mucosa and intact with no bleeding. And it is pink color, moist, firm, with tight margin to the tooth and no lesion. So now I will inspect the hard palate and the soft palate. So eliminate seeing using the pin light, inspect the soft and the hard palate. Then, so sir, I will inspect your soft and hard palate. It is okay for you, sir?
Yes.
Can you open your mouth, sir? No, sir. Igo, hindi na. So, as I inspect the soft and hard palate, it is pink color, smooth, moist, and no lumps, tenderness, and masses. So the soft and hard is no infection. It is normal. So now I will inspect the salivary gland using the pen light to eliminate inner aspect of the cheek of my patient. Then uses thumb blade to retract cheek and inspect Stinson gland and to instruct patient to left while I inspect his Wharton duct. Sir, can you open your mouth again? Just straighter. So, no redness, swelling, pain, and it is visible, moist in the area. Now, sir, I will inspect your tongue. So, I will instruct my patient to protrude tongue, inspect tongue for color, texture, and moisture. Instruct my patient to tongue move tongue. So, sir, can you protrude your tongue? Then I will inspect for color, texture, and moisture. So the tongue of my patient is pink color, moist, moderate size of papilla, no lesion, and the tongue is offers strong resistance. Now inspect oropharynx for color, lesion, and drainage, and instruct my patient to open mouth and protrude tongue. Then I will use my pen light to inspect oropharynx. Sir, can you open your mouth and protrude tongue? Protrude. Open your mouth. The oropharynx of my patient is pink color, no lesion, and no drainage. So now I will inspect the tonsil of my patient for color, size, and exudate. So I will locate the tonsil posterior to our arc on side of the tooth. So verbalize finding uses tonsil grading finding. So I will verbalize the finding uses tonsil grading scale. So, sir, can you open your mouth? Then protrude your tongue, sir, so that I can see your tonsil. So the tonsil is of my patient is here. Here. The tonsil is near of the opening of nasal cavity. The tonsil of my patient is normally pink, symmetric, and enlarged 1 plus. As I reading using the scale, no exudate, swelling, and no lesion. So now I will inspect the uvula of my patient and have patient say ah. Then check symmetric rise of uvula. Sir, can you say ah? So it is symmetric elevation. Fleshy of my patient is symmetric elevation, fleshy, solid structure, no lumps, no masses, and no lesion, and freely in the middle. So I will palpate the lips of my patient for consistency and tenderness. Palpate the external portion of the lips. Palpate the inner portion of the lips. So, the lips of my patient is smooth, moist, without lesion or swelling. So, now I will palpate the tongue of my patient for consistency and tenderness. Use clean gauze in holding tongue and palpate the tongue using glove. So here is the gauze in holding the tongue. So here is the gauze for holding. So here is the gauze in holding the tongue of my patient. Can you protrude your can you open your mouth, sir? Then protrude your tenderness, no lesion, ulcer and or nodule are apparent. So now I will palpate the gland like parotid gland, front of the ear, and the submandibular under the mandible, and sublingual gland under also in the mandible. Is this okay for you, sir, if I will palpate your gland?
Yes.
So first is the parotid gland, front of the ear. It's pain, sir.
No.
And next is the submandibular. You feel pain, sir?
No.
Then the sublingual. You feel pain in the sublingual, sir?
No.
Okay, thank you, sir. So, as my patient verbalized, no pain in parotid gland area, submandibular area, and sublingual, and I see no tenderness, no lesion or swelling. So now we will perform the test gags reflex. Use tongue blade, then stimulate gag at the posterior aspect of oral cavity. Then this test is for the cervical nerve 9, number 9, and number 10, number 12. Can you open your mouth, sir? So there is a presence of gag reflex. Then the gag reflex of my patient is normal. Demonstration of nose, mouth, sinuses is done. But before that, I want to say thank you, sir, for cooperation, for helping me this written demonstration to be complete. This demonstration. Thank you, sir. Thank you so much, sir.
You're welcome.
And now, I will remove my gloves. Then I will trash this for safety. And never forget to have a proper hand hygiene. So thank you for watching this video, this demonstration of nose, mouth, and sinuses. Again, thank you.